A lot has been said about isolation wards, especially in the coverage of this coronavirus outbreak. Well, if you have ever wondered what an isolation room for a COVID-19 patient looks like and the steps it would take to treat a patient, with exclusive footage, Anita Nkonge shows us just that.
Patients who think they have COVID-19 symptoms are required to call the hotline number *719#. If the doctor believes you have the virus, an ambulance would pick you up and take you to hospital. If you show mild symptoms, you would be sent home to self-isolate. However, if in need of admission, patients are split into two groups. Those in the general ward are put into a general ward isolation room.
So in the general ward is somebody who needs, for example, oxygen, has severe chest pain, but doesn't need a ventilator, doesn't need dialysis, doesn't need to be intubated and can maintain their blood pressure. When you can't do that, that's the next step, and that's when we take them to ICU isolation. If you have very many patients with coronavirus, that's confirmed, they can be in an open ward, but as long as the beds are a certain distance apart, about 2 meters, mostly 1.5 meters to 2 meters apart. But these are patients who are confirmed to have coronavirus. Those who are not confirmed should be in rooms on their own while we're waiting the result, because we don't want them to get infected.
However, if the condition of a COVID-19 patient deteriorates, they would be brought here to the ICU isolation ward for further treatment.
It's called a negative pressure room.
The isolation rooms have negative pressurization spaces.
The importance of a negative pressure room is that the air doesn't mix between the two. So if a patient has a certain condition, it doesn't go out and infect the people that are outside or other patients that are there.
I have the mask.
Inside the first chamber, known as the negative isolation room, the nurse would first begin by checking off her list of required items before seeing the patient. The nurse would then get dressed. The headgear first, then the shoe covers. The eye shield and mask is a must. Then the gown. The hand gloves are strategically placed on top of the gown.
Patients who need intensive care unit need to be looked after by an intensive care unit nurse. And a nurse and a doctor has to wear such gear before they go in to see the patient. Now, not all patients need this. So these are patients who will need procedures. The nurse will be doing their blood pressures, cleaning them, taking out their respiratory secretions. So because she's going to be hands-on with the patient, she has to wear this to protect herself.
This is where a patient would be laying. The ICU room is fitted with several machines to support the patient, such as a ventilator machine which would help the patient breathe, a kidney dialysis machine in case the patient goes into renal shutdown, an intravenous machine for providing fluids, a monitor showing the patient's vitals, including heart rate and blood pressure. Once the nurse is done with attending to the patient, she would don off, which would mean discarding the clothing equipment and throwing it away. At this point, relatives or friends of the patient would not be allowed to enter the patient's room. Anita Nkonge, NTV.